So let's be real. Chronic pain is a big business in the medical industry. There's no fortune to be made in getting people off medications, out of pain, and backing to living their lives. So instead, the system thrives on symptom management and not actual resolution.
Welcome to Health Decode, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
All right, you were born ready for this. Welcome back to Health Decoded, where we unravel the complexities of health and wellness with science-backed insights. I'm your host, Dr. Alfred Alessi.
And the famous co-host, Matt Tack.
Good to see you, man. Today's episode is all about you, the listener, and giving you real answers to empower you to live to the healthiest and highest version of yourself.
Yeah, today we're going to be highlighting some questions we commonly hear that we helped patients debunk and get functional, actionable answers. And here's a quick teaser. Stay tuned, as these questions could have questions you've been having.
A little bit of a mouthful there for you, guy. Man, what's going on with the beard? You trying to look like me or something?
I am. I'm growing it out a little bit. Maybe it's a little bit of laziness, but I'm digging it.
I'm digging it too. It's a good look. It makes you look a little bit like more lumberjacky.
The thing is like mine grows straight out. It's kind of weird how that happens. It's like some guys like get that natural curl, and then mine's freaking all wiry and grows straight out. It's weird.
Well, it has to get some length first, man.
My girls like tell me, they're like, you can't kiss me with your beard, because I'm like, it just goes straight into them like needles.
We'll clarify for the listeners, by girls he's talking about his daughters, not like a slew of women that he's kissing. So
that's true. I got a lot of girls in my life.
Awesome, man. Well, just a couple updates for everybody. We're doing a really cool thing on March 8th, man. I'm super excited. We're going to be doing our Spring into Health block party at the clinic, Alessi Functional Health in Tampa, where we're going to be having a bunch of really cool things going on. We're going to be doing complimentary x-rays and evaluations and health screens for our patients and friends and family, anyone who shows up. We're going to have tons of free food from some local vendors. We're going to have some local businesses out there displaying themselves. There's going to be a dance fitness class with Jenna from Bands and Booty. There's going to be ideally some other boot camp kind of fitness going on. And then some chair massage from a good friend, Jake Naderman, with Up Leveled Movement. So it's going to be a really cool time. If you're in the Tampa area, March 8th from 9 to 1 p.m., definitely come out. Completely free event. Would love to see everybody out there.
We'll have some time slots for the exercise portion as well. So you'll be able to kind of tag in when those come about. So we'll make sure to get those programmed beforehand so that you can sign up for some classes. You can get that booty fit, or you can do some other classes that you might enjoy.
Awesome, man. Yeah, looking forward to that. Well, let's get into it, man. Today's episode, we really wanted to provide a ton of value just based on the things that we hear on a daily basis in the clinic. These are questions that we get all the time. We've been doing this for 5 years, and a lot of the questions tend to repeat themselves because we see the same things in this field. So we basically came up with like a list. We have like a running list of questions we hear, but for today, we came up with a list of some of the more common ones. And we just kind of want to get into it and provide a little bit more detail. So we really put some time into answering these for you guys. So also, I will say, if this is something that rings a bell or strikes a nerve with you, then let's connect and let's see if we can help you out, because there are ways to get around these things that you don't have to be frustrated and you don't have to deal with these symptoms and stuff like that. So let's just start. The first one we have here is, we hear this all the time. Hey, my doctor quotes, my doctor says my labs are normal, but I still feel awful. I still have symptoms, whether it's fatigue, bloating, struggling to lose weight. So is there something missing in what they tested me? And, so this is classic, man. Your labs are normal. So the doc's like, well, it must all be in your head. But here's the deal. Conventional lab ranges are based on statistical averages of the general population. which is not necessarily what's optimal for health, right? Is average is not optimal. So let's be real. If the general population is increasingly overweight, inflamed, dealing with chronic disease, do you really want to be in that average normal crowd? Probably not, right? If we're talking about what health is and what like thriving is. So traditional medicine relies on reference ranges that are designed only to catch the most extreme cases of dysfunction. So if you fall within that range, traditionally trained doctors are just going to say you're normal, right? But they don't. The problem is these ranges don't account for functional deficiencies, where a marker might technically be normal, but still suboptimal for proper physiological function. So that's where functional medicine, the approach we take, we dig deeper. So instead of stopping at the bare minimum, we take a systems based approach. We're looking at how different biomarkers interact and whether they align with optimal function, not just the absence of disease. So, for example, let's talk about thyroid function. Most conventional doctors will only run a TSH test, right? That's your thyroid stimulating hormone. If that falls within the lab range, which can vary widely, by the way, between labs, they'll declare that thyroid as normal. But here's what they're missing, and I see this all the time. So TSH is a signal hormone. It's not actually a thyroid hormone. It tells your thyroid what to do, but it doesn't measure if the thyroid is actually producing the hormones efficiently or if your cells are using them properly. So many patients have a normal TSH, but still feel awful because the free T3, which is the active thyroid hormone, is low, or even their reverse T3 is elevated. So then this blocks proper thyroid function. Also, other things like autoimmune thyroid conditions like Hashimoto's, it doesn't show up on a TSH alone. So the research actually shows that 90% of hypothyroidism cases are actually autoimmune in nature. That's a huge number, man. 90% of hypothyroid, which is very common, they're autoimmune, meaning the body is attacking the thyroid gland. This is really cool. A study published in the Journal of Endocrinology and Metabolism found that 50% of people with normal TSH still had symptoms of hypothyroidism due to an undiagnosed conversion issue or an autoimmune thyroid disease. So this means millions of people are being told they're fine while they're still struggling with the die-off symptoms of that, which is weight gain, brain fog, cold intolerance, which is kind of a random one, but people have that, and then fatigue. And so this is all because they didn't check beyond the surface. They just looked at the one marker. Another example I'll share is blood sugar and metabolic health. So it's more than just about glucose, right? Another major blind spot in this conventional testing. So many doctors will check your fasting glucose, but it's really just a snapshot of the blood sugar regulation. By the time fasting glucose has been elevated, insulin resistance has often been developing for years. So a better approach or a more functional approach is checking fasting insulin, hemoglobin A1C, and even doing like a continuous glucose monitoring. So that's where you wear one of those devices that kind of taps into the capillaries on the surface of the skin, and it gives you constant feedback. The technology is really cool. It's Bluetooth to your phone. You can just track it, even alerts you if you get a spike in blood sugar or if you dip. So again, that's a more functional approach. A study in the Lancet Diabetes and Endocrinology showed that 88% of US adults have some degree of metabolic dysfunction. Man, these are all big numbers I'm spitting out here. 50%, 90%, 88%. So, I guess what I derive from that is that the conventional medicine approach just seems to be missing something. If people are going to their doctors and they're still 88% of people have some kind of metabolic dysfunction, right? So we talk all the time about what is lifestyle, what is functional health look like. So the last one I want to really share is gut dysfunction, and this is often overlooked. So gut dysfunction really is the key to inflammation and chronic disease. Standard lab panels ignore gut health, right? Despite the massive impact it has on metabolism, inflammation, immune function. If you have bloating, food sensitivity, brain fog, your doctor might just give you a label IBS and then say, you're on your way, right? But functional medicine is going to look a little bit deeper. So we can do things such as comprehensive stool testing, where we're going to assess imbalances within the microbiome. We can see inflammation. We can see if there's infections, parasites. We can check things like leaky gut markers. So there's a protein called zonulin that actually maintains the strength of the cells, the cell wall in your gut lining. And if there's issues with that protein, we can test for that and see if someone has things like leaky gut. Another thing is things like SIBO, which is small intestinal bacterial overgrowth. A lot of docs don't even know to test for this. And many cases of IBS are actually an overgrowth of bacteria in the small intestine that's then causing those symptoms. So really the bottom line, man, is if your labs are normal, but you feel like trash, it's time to look a little bit deeper, right? Something's being missed. So just because a number falls inside this arbitrary range doesn't really mean your body's functioning optimally. It just means you're in the same state as everyone else, which is probably suboptimal health, right? So getting a second opinion, not just a quick glance, is going to be a better take. And conventional medicine often just waits until a disease develops before really acting. Whereas functional medicine, we're preventing disease. We're going to optimize health and ensure that you actually feel your best, not just not sick, right? So that's I know that's a mouthful, but I really think for when we hear that question, that's the route we need to take.
Yeah, that's like such valuable information too, in terms of how you can be the educator of your health. And when you go to a standard general practitioner, which many of our friends and a good friend of mine, Jason, is the exact same thing, right? He is showing precursors to just chronic pain. He's trying to figure it out, but his GP had no idea. So he's like, look, I can't help you. Um, and so dealing with that root cause is an understanding of like, does he have fundamentally what do his labs look like? And then fundamentally, how can we identify some of the things that you just mentioned? But, just kind of bringing it back home, I've been dealing with chronic pain for years. And even when I didn't know, right, you don't know what you don't know. Um, how was I going to heal my body? And so we did the same thing, a couple of years ago, I think at this point, maybe it was like last year, we had to dive into what my numbers looked like. And that was me being proactive and wanting to just figure things out, right? Where I even had a small thyroid issue and within my T3. And so we had to figure that stuff out, and I had to create that hurdle. And then have now since navigated on the complete flip side, which my blood work comes back consistent every time. But why chronic pain? Let's talk about this. Why chronic pain is a cash cow for the medical system, and no one's fixing it at the source. So let's be real. Chronic pain is a big business in the medical industry. There's no fortune to be made in getting people off medications, out of pain, and back into living their lives. So instead, the system thrives on symptom management and not actual resolution. So let's dive into just a few things that we need to talk about on the way the models are structured. So most conventional pain management follows the pharmaceutical first model. So I'm sure you've seen this when you go into a standard practitioner. Get an antihistamine, right? Take some ibuprofen. Those things are just to mask the inflammation that you're having in your body, right? Tylenol, all those things that are going to be over the counter, let's mask it. Instead of looking at maybe it might be a dehydration issue, right? A lot of times getting your proper pH levels figured out before taking an Excedrin or an ibuprofen is the best protocol there. Muscle relaxers to numb the tightness, right? Where there's other things that you can use like self-myofascial release on some tight muscle groups, of getting a foam roller, right? Those are different actionable items that you can take. Hey, I got a strain, getting body work done, routine body work done. That's like an important thing instead of masking it with other antihistamines, right? The other way, which is steroid injections to suppress symptoms temporarily, right? A lot of times people, we'll just give you a cortisol shot, or we'll give you a steroid injection to just mask the pain once again, instead of diving into, well, why is that pain there in the first place? So asking those questions of, do I really need this? Now there are times where maybe those are appropriate, right? to just settle the muscles down and get them to relax so that you can use other measures. Opioids are a major thing in today, right? When the pain persists, hey, just like mask it again. Now, those aren't long-term things that you need to put in place because those will ultimately be damaging to other organs in your body. You want to make sure you measure those things properly. And then when all else fails, hey, we got to give you surgery, right? And usually that's the case, is that like, hey, we're going to be angling you towards surgery so that you walk away with a massive medical bill, or your insurance is stuck with it. Instead of trying to figure out, hey, do I need this? And then what are measures that I could take that potentially could get me out of this and I don't need surgery, right? There are always measures, always better questions that you can ask. So here's the problem. None of these approaches actually fix the root cause. They just slap a Band-Aid on the symptoms and then keeping patients dependent on ongoing treatments, right? I got to buy this again. I got to get more antibiotics, whatever it looks like. But if we look at the science, it's clear that chronic pain isn't just about pain itself. It's about what's driving it. So we always say, ask better questions, get better answers. And the true root causes of chronic pain. So let's dive into these a little bit further. A lot of doctors just flat out ignore these. So chronic inflammation sensitizes pain receptors. Inflammation isn't just a buzzword. It's one of the primary drivers of a persistent pain. And we love adding in these things because people have done the research. So a 2020 study in the Journal of Pain Research found that systematic inflammation lowers the pain threshold. So making the body more sensitive to pain signals. In other words, the more inflamed you are, the more everything is going to hurt. That's just stress loads that are on your body naturally create more inflammation. So you need to utilize other measures to reduce that pain or that stress threshold to reduce the inflammation in your body. So inflammation leads to nerve hypersensitivity, amplifying pain signals even when there's no active injury. So that can lead to other areas. One thing we do in our clinic is we target the core root of the pain when it's actually might be creating inflammation in other areas. That's called our soft wave technology that basically naturally creates that regeneration in new tissue that reduces the amount of inflammation in the target source. So that's a natural way of producing your body's stem cells. And it could be, hey, the shoulder could be indicating a number of other areas, but if you deal with it directly where it's at, it could hinder some other areas. So another thing that we want to talk about is inflamed tissues have poor blood flow and healing capacity, which is why injuries and aches seem to linger indefinitely. So we just want to make sure that the restricted blood flow, hey, how much blood flow are you getting into your body that naturally, that's why we believe in saunas, right? Getting in saunas where you increase your blood flow, which exacerbates, I shouldn't say really exacerbates, but increases the amount of blood flow, which increases the promotion of just healing throughout the rest of your body. And what fuels chronic inflammation? So we go back always to the root cause of like, hey, what are you putting in your diet? One of the big precursors that we like to explain to everything is like, usually it's dehydration that starts out, right? Not people getting enough water throughout the day. You need to drink at minimum really 3 liters of water. I love getting a liter jug and getting about 3 of those in daily. I do believe that liquid IVs and other portions that you can put those in there. Those do have some sugars, processed sugars that you probably don't want to be adding all the time. So you don't want to be continually dumping those in. Just water is a great source. So, but other things that are precursors to this is highly processed diet, right? Chronic stress, poor sleep, a sedentary behavior. So are you eating and sitting down and watching TV, right? One of the things that we've done as a habit structure within our family is we typically eat and then walk, right? That reduces that glycemic spike that you might have from carbohydrates and fats that you've been eating for dinner or lunch. And so just walk, even a 5-10 minute walk really helps and reduces that glycemic spike that you might have. So all things conventional medicine rarely address, right? Like, hey, go for a walk after you eat. That's typically not a question that's asked. Do you walk after you eat? Are you properly hydrated throughout the day? So other things that we want to tap into is just poor movement mechanics and postural dysfunction that destroy joints. So most people don't injure themselves in one big catastrophic event. Instead, chronic pain develops due to years of sitting too much. So that's a weakening of core stability and the shortening of the hip flexors, right? So you'll see yourself, and that's where we kind of come into the clinic and structurally realign that, is to really elongate those hip flexors so you don't have any type of anterior flex. Repetitive faulty movement patterns, like walking with poor gait mechanics. One of the things that our friend Jake is that for years I was running incorrectly, right? I wasn't running where the outside of my toes roll in. And so even though it's a nerdy way to look at things, there was one of the things that I even had to look at of how I was running, and how I should properly be laying my feet, and I should be bowing my toes forward and landing on my toes and letting my heels come down softly. So even a running pattern is really important because usually people strike with that heel first, right? So those are the things to ask yourself as far as how am I walking, right? Are my legs like bowed in? How can I work on my abductor? I might have an abductor complex where my just knees are tilting in a little bit when I'm walking. So those are just some of the things from a walking standpoint, how important that is. And then ignoring muscle imbalances leading to improper joint loading and excessive wear and tear. So to explain this a little bit further, when you're ignoring your muscle imbalances, those are just some of the things that have triggered from you maybe sitting throughout the day, you becoming a little bit more shelled and rolled with your shoulders because you've been kinked up and dialing on a keyboard for a number of years. Your neck is actually loaded a little bit forward, which creates muscular imbalances in your delts and your neck and the cervical region. And you're all crunched up, right? What does that do? That tightens up your whole body. So your stress load is so much more increased, and you have all these imbalances. And until you rectify those, that stress will lead to diseases, right? And so that's the importance of just getting that relaxed state, of making sure you have spinal realignment, both in the hips and in the cervical region. But here's the catch. So we don't want to just sit here and obviously dog on, Western medicine, but there are questions that you need to ask. So most doctors never assess the biomechanics of your body, right? They won't look at you and be like, hey, the first thing we need to look at is actually your spinal alignment. And the second thing we probably should reduce a little bit of that weight, right? Being honest with people is an important thing. We need to lose weight. We need to get your spine realigned so that you can reduce that stress load. Instead, they prescribe painkillers and tell patients to, you probably should stretch a little bit more, right? What does even stretch
What does
look
that mean?
stretch look
Yeah.
like, right?
Yeah.
Which doesn't fix the root issue. So as we dial in the functional medicine approach to actually fixing chronic pain. So here's some mechanics that you can use. If a pain is a symptom, not the problem, then the goal should be to identify and fix the root cause. That's exactly what we do with an integrative approach. Number one, the spinal biomechanics correction. So CBP has been proven in clinical studies to restore proper spinal alignment and reduce chronic pain long-term. So we talked about getting the spinal realignment. That could be through decompression therapy. That could be through a number of different things, but decompression therapy and chiropractic correction, right? Unlike traditional chiropractic adjustments, CBP focuses on correcting posture and movement patterns, preventing pain from coming back. That's one of our, main goals at Alessi Functional Health too, is to allow you to live with a pain-free future, right? It's to educate you through the process. That's our one differentiator, that we think we do the best, the absolute best in the game, is educating you so that you can go out and do it yourself, right? And then we're always here for you. But those things are things that you can use. Soft wave therapy for stem cell activation and tissue regeneration. It's something that I talked on a little bit earlier, but soft waves use electrohydraulic shock waves to stimulate stem cell production, reducing inflammation, accelerate healing. Um, Check this out too. This is really cool. Some clinical trials have shown that soft wave, they've used this quite a bit in Europe too. I like how Europe, usually things follow, right? Europe will, because they have a less restrictive, they're a little bit more forward thinking in terms of like how they're utilizing. A lot of people walk too. So generally they aren't as overweight. So they can use technologies like this. But clinical trials have shown that soft wave therapy reduces pain up to 70% in just a few sessions, particularly for tendon and joint issues. And I just want to note on this, the reason why tendons and joints are so imperative for the purposes of longevity is because that's what holds your muscular structure, right? So the largest organs in your bodies, the strength of your tendons and your joints are going to be a direct indicator of how much muscle mass you can hold on to later in life. We need to make sure that we are protecting those. And there's not an insane amount of inflammation, right? Anti-inflammatory nutrition to lower your pain markers. So this is where, some supplementation comes in, but mainly it's through whole food sources. But excess omega-6 fatty acids from vegetable oils like drive chronic inflammation, right? While omega-3s from wild-caught fish, grass-fed meat lower it, according to the Journal of American College of Nutrition in 2018, that study. The cutting out of processed seed oils like canola oil, soybean oil, and sunflower dramatically reduce inflammation and pain levels. As we kind of wrap up my segment here, but targeting strength and mobility training, we have GOTA and ATG methods, but the GOTA, the greatest of all time actions, something that I kind of explained it in a little bit detail, but identifying faulty movement patterns and retrains the body for optimal biomechanics, reduces stress on joints. That was one thing that I did because I realized my impact on my heels needed to be reverted to more toe action, right? So I have this rolling effect where I have a softer impact on my heels. So the ATG, the Athletic Truth Group system, focuses on strengthening the full range of motion, preventing joint breakdown. As we were talking about joints, how pivotal joints are in promoting muscular density, right? And maintaining that stronger joints you have, the more muscle mass you can hold on to. A study in the Sports Health in 2021 found that targeted strength training reduces chronic knee and back pain by 50 to 80% over time, something drugs could never, ever accomplish.
Man, and you said something there that is just so profound. It's like fixing pain at the source and getting to the root cause of people's problems and getting them healthy is actually bad for business, right? And so that's the whole concept here, is that conventional medicine and pharmaceutical industry, it's a business, and everyone knows that by now. So if more people corrected their biomechanics, improved their metabolic health, reduced inflammation naturally, guess what? They wouldn't need these lifelong prescriptions of pain meds. They wouldn't need the recurring steroid injections or the expensive surgeries that in this country, the failure rate of surgery is 50%. So flip a coin. You might come out there with a successful spinal surgery. You might walk out of there debilitated, right? And so that's bad business for the pharmaceutical industry, is that they're just managing something so that you keep coming back. And so we, like you said, we do it differently at our clinic. And I tell every single person I meet that my goal is for you to not need me, right? Like if I have you coming back to my office over and over again with an issue, right, with an active acute issue, then we didn't do our job. A lot of patients continue to come to us for preventative and optionally for maintenance care because they choose to, but they don't need to. And so, we've kind of taken the chiropractic model and gone a different route. We're not trying to keep you on the hook forever. We want to discharge you at some point and say, hey, you're good. Now just maintain what we've taught you and you'll be good, right? And let us empower you through this and educate you through this whole process. And now you are the one who's in control of your health. So that's kind of the approach we take. And I've had other chiros be like, dude, that's not a good business model. And I'm like, well, we get a ton of people sending us their friends and family, and it's actually been pretty good for us. So because people want to get out of pain, they don't want to feel like they're there forever. They want an end line, right? And so that's our goal. Um, so the next question that we had here on our list is, let's see. I was told that taking medications for my thyroid or blood sugar is my only option, right? And this kind of goes for anything. Are there natural ways rather than just managing the symptoms? And this is kind of what we just talked about, right? Medications are not a real solution because they are not bioidentical. Your body has to figure out what this is, and it's going to have an action inside the body, but it's not actually going to assimilate and do something that's going to naturally cause your body to start healing. So I wouldn't say that I'm 100% anti-medication. There's times when they're necessary, right? For short-term interventions, acute conditions, or life-saving emergencies, of course. But the problem is they're handed out like candy, right? Often without a second thought as to like, why is the dysfunction happening in the first place? And I think we're just going to continue to beat the drum on this and beat this dead horse in our podcast that there's other options, right? And so the medical the conventional medicine operates basically on a diagnose and prescribe model. So you have X, here's X drug, right? You have Y, here's Y drug. And it's kind of a lazy system, if you ask me. Nobody's really asking like, why did this happen in the first place? Hey, did you have a stressful event that might have triggered an autoimmune condition to then now lead to these symptoms, right? Did you go through some kind of major trauma, right? What are these more in-depth causes? So, a couple of case studies that we've got, and I'll kind of share here, is like managing versus reversing type 2 diabetes. I think this is something that people still don't know, is that type 2 diabetes, which is a lifestyle related disease, it's not a genetic condition, is reversible. I'll say that again, type 2 diabetes is reversible. We have done it in our clinic, and we've helped people to get those numbers to normal. So, most doctors universally will just prescribe metformin and tell patients to watch their diet. But like, what does that even mean, right? Go low carb, go keto. But they don't teach patients how to actually reverse insulin resistance, which is the issue, right? That's the root cause. So a 2021 study in Nature Medicine found that a low carb, high protein diet combined with resistance training can reduce hemoglobin A1C levels as effectively as metformin. Wow. Right? So why? Because it addresses the root cause, which is the insulin resistance, rather than just suppressing the blood sugar levels, which is the symptom. So what actually causes insulin resistance? Chronic consumption, chronic overconsumption of refined carbs and processed seed oils, lack of muscle mass, right? Muscle mass is the largest site in your body for glucose disposal, and poor sleep and high stress, which are going to bump cortisol up and then lower insulin sensitivity. So instead of just handing out metformin, like, why aren't we teaching patients to cut out the processed sugar and the seed oils that are fueling the inflammation? Encourage resistance training. This is something you and I preach, right? Get that muscle mass up because it's going to improve glucose metabolism. Your body's going to utilize that glucose more. And then addressing sleep quality and stress, which are going to directly impact insulin sensitivity and cortisol. So if patients actually reverse their diabetes, they wouldn't need metformin for life, right? But again, that's bad for business for the people selling metformin and the big pharma. Another
Also to
study,
add,
yeah,
to add to that, and what a lot of people don't know, and that's why this needs to be said, is that it's not even just metformin that these type 2 diabetics are on, but a lot of people, that have excess weight, because those are typically the people with type 2 diabetes. They'll, prescribe a GLP-1, and that will actually be targeting your muscle mass first, which is why we say resistance training first, right? Because if you're going to get on that, you're going to be losing 30%, up to 30% of your muscle mass, which it's not fat loss, it's actually muscle loss. And so when you combine those things, it's actually not the greatest precursor for for what longevity looks like to you, because you're losing so much muscle mass in that time. What you want to do is be targeting that fat first, right? Lose the fat while you're gaining the muscle. And then over time, with a level of consistency and resistance training here, I like getting into what it should look like at minimum of 3 days a week for 45 minutes. That's what resistance training should look like for a type 2 diet.
Yep. And so to expand on that, go listen to the last episode we did about weight loss and we got super into the weeds and deep. We did a deep dive on everything you just said there. So that's a good summary. So, kind of to wrap up this question, like medications should not be used as a lifelong thing. They should be a bridge between acute, right, emergent kind of thing to get you back to then lifestyle. So medications can be a useful tool, right? But they're never the only tool. So I'll let people need to know that, right? There's other options, but again, temporary. So you're just putting a Band-Aid on a bullet wound sometimes, right? So this is exactly why we take functional medicine approach to look deeper, because the goal isn't to keep you dependent on drugs. The goal is actual health restoration. And so, again, like it's not the best business model because we're giving you healthy, we're giving you the answers, and now you can do it on your own. But we're not in the business of taking people's money and keeping them sick. We're in the business of empowering and changing the world really through an impact that's going to be passed down through generations ultimately.
So here's question number 4. I eat well and exercise, but I still have some gut issues, inflammation, and brain fog. Could hidden toxins, food sensitivities, or stress be the missing link? So your gut is the command center of your health. You have to understand that. It's going to dictate everything. It's going to have a neurological release to your brain. All those things are going to be dictated from your gut. In fact, they say your gut is actually your first brain. Yeah, that's going to actually show you everything that else is that's going on. So you want to make sure when you have more of an alignment with your gut, you're going to have you're going to have a deeper spiritual sense. You're going to have more cognitive release. So make sure these are the things that you want to be putting in place. So the gut isn't just about digestion. It's about the command center for your immune system, brain function, metabolism, and even mood. If your gut is off, everything is off. You know it. But here's the problem. Most people don't realize they have gut issues because they don't always show up as bloating or stomach pain. Instead, gut dysfunction can manifest as brain fog and fatigue, joint pain and inflammation, anxiety and depression, autoimmune diseases, chronic skin condition like eczema and acne. And yet conventional medicine barely acknowledges gut health issues until you've had full-blown IBS or even Crohn's or colitis. But let's break down why your gut is so critical to overall health and why just eating more fiber and popping a probiotic isn't enough. Those famous greens that everyone is on nowadays, right? So here's gut dysbiosis, the root of chronic inflammation and disease. Your gut is a home of trillions of bacteria that regulate immune function, neurotransmitter production, and metabolic health. When your gut bacteria are balanced, you feel great. When they're out of whack, then there's dysbiosis. If it can trigger systematic inflammation and disease. So here's a study done in 2021 by gut microbes found that gut dysbiosis is directly linked to autoimmune conditions, chronic inflammation, even mood disorders like anxiety and depression. So translation, your gut microbiome doesn't just affect digestion, it affects your immune system and brain, which affect your digestion, right? And what's wrecking people's gut health? Antibiotics, right? That's wiping out the solid gut bacteria that you have. So think of your kids, right? If you're constantly putting them antibiotics every single time, they get a little sniffly cold. That's exactly what it's doing. Glyphosate, herbicides and non-organic food, right? Which have been linked to a leaky gut and microbiome disruption. Processed foods, as we talked about, artificial sweeteners, which feed bad bacteria and cause inflammation, chronic stress and poor sleep, all things that we mentioned, both of which alter gut bacteria and composition. And gut health isn't just about digestion, it's about preventing chronic disease before it even starts. So let's dig into a little bit about what leaky gut is. So typically, this is where people are going to see this a little bit later in life. You're not going to see this. You could see this at an early age, right? We might be actually seeing it more with the amount of gut dysfunction that we're seeing in adolescence. If you're an adolescent with leaky gut, that's those times are probably coming, but typically you're going to see this in your 20s and 30s. Leaky gut is intestinal permeability. All right. So just to give you a little bit of explanation about how the gut works, it breaks down your food through the large and small intestines. It's broken down. All those micro macronutrients are then get into the gut, and then they're pushed out into the bloodstream. So if you're in chronic inflammation, you're not getting enough of those macro micronutrients if your quality, if your food source isn't there. So this happens when the lining of your gut becomes damaged, allowing toxins, bacteria, undigested food particles to leak into your bloodstream. This triggers chronic inflammation, food sensitivities, and autoimmune reactions. So in a research in the Journal of Clinical Gastroenterology found that increased intestinal permeability is linked to autoimmune diseases like Hashimoto's, rheumatoid arthritis, and even multiple sclerosis. So what causes leaky gut? So you have a number of different things that we already talked about, but glyphosate, again, that's a herbicide in conventional food, weakens gut lining and integrity. So then you have like the ibuprofens, the aspirins, NSAIDs have been shown to increase gut permeability. So doing those on a daily basis is not something as a precursor for longevity, right? Gluten and seed oils could trigger an inflammatory response that worsens gut barrier dysfunction. So if you're struggling with chronic inflammation of joint health or autoimmune issues, your gut is likely part of the problem. Where you're going to dive into the most, where you can have a body that naturally heals itself is when you focus on your stress and sleep receptors, right? The overlooked gut killers. Most people don't realize that stress and lack of sleep can literally change your gut microbiome. As your body recovers, this is what's kind of cool about how the body works is that when you get proper sleep, your spine is actually releasing fluid, right? And allowing your cerebral fluid just to go and cleanse the brain, right? And so you get a therapeutic sleep, which indicates everything else in the body. So if you're not getting proper sleep, your brain is not getting the proper nutrients that it needs to potentially reduce the amount of inflammation in the body, particularly in the gut. So they're all interconnected. High stress levels increase cortisol, which directly impacts gut bacteria, increases gut permeability. Decreased digestive enzyme production, leading to bloating, reflux, and nutrient malabsorption. This is important because what people don't realize is that when you have a backup and you have heartburn, you have indigestion, that typically is because you have not enough enzymes within the stomach, right? So you want to make sure that maybe that you can incorporate some apple cider vinegar or various things that have more digestive enzymes built up so that you're aiding that into the production of the breakdown before it gets into the large and small intestine, right? Fuel cravings for processed food, sugar, further reckoning of gut health. So the gut-brain connection is very real. And if your nervous system is constantly in flight or fight mode, your gut health will eventually suffer.
Yeah. So, like that's great, man. And then it's all about, again, like coming back to what's the functional medicine approach to gut health. And so you said it, like instead of just throwing probiotics on the problem, which is like basically like planting flowers in a toxic waste dump. You're throwing a bunch of good stuff onto something that's not working. So the systematic approach is, number one, we have to identify what are the inflammatory triggers, right? So we can assess for food intolerances such as gluten, dairy, seed oils, artificial sweeteners that are contributing to the inflammation. Then you got to balance the gut microbiome. We can check for stool tests. We can see if there's dysbiosis, SIBO, candida overgrowth, parasites, toxins, and then find out what those are and now reduce that toxic burden. So, if there is glyphosate exposure, heavy metals, mold, how do we get those out? And then heal and rebuild. So we use a combination of elimination dieting, fasting, anti-inflammatory nutrition, gut healing nutrients, some of the best like glutamine and collagen, and then lifestyle changes to restore gut health from the ground up, right? It's all about lifestyle, because if you can create something that is foundationally part of your lifestyle, then you can do that forever, right? And so a healthy gut is going to equal better metabolism, brain function, immune system. But most doctors are just completely ignoring this now. So unless you're dealing with full blown digestive stuff, they often just kind of dismiss you as, again, IBS in air quotes. So if you're dealing with chronic inflammation, brain fog, weight issues, autoimmune symptoms, your gut is the first place to look, because if your gut is off, everything else will be off, right? So last question before we wrap up. This is just one I really, really want to drive home is, and to say it in a nice way, right? If your doctor is dismissing you, or if your doctor is not listening to you or telling you that it's in your head, get a different doctor. Get a more functional doctor who's going to sit there and take the time to understand what your problems are. So this is something we hear a lot, right? It's every time I bring up alternative treatments like functional medicine or hormones balancing or gut health, my doctor doesn't take it seriously. So, like, why is conventional medicine so resistant to these holistic approaches that I've heard work or actually do work, right? And so, again, beating the drum here, conventional medicine isn't about prevention. It's about lifelong customers, because it's a profit driven system. These doctors have to hit quotas of how many medications they give out a month, a week, whatever, right? And that's just the truth of it. That's the ugly truth. So the pharmaceutical companies are the ones funding the medical schools, the research, the guidelines. So the entire system is set up for them to have their kind of stake, right? Or their way. So conventional doctors they're trained to prescribe, not prevent. That's just how it is. I'm not saying that they're bad people. I'm not saying that they're ill intentioned. That's just how they're trained, right? And so if you were a professional athlete and you were trained to do one thing, and then now they're telling you to do this, you're going to have no idea what that is, right? So they're trained to diagnose and prescribe medicine. So according to JAMA, the Journal of Alternative Medicine 2019, the average doctor receives less than 20 hours of nutrition education in their entire medical training, right? So your doctor's not going to be the one to tell you how to eat healthy. It means they probably know more about the latest diabetes drug than actually how to reverse insulin resistance with diet and exercise. So, honestly, let's be real. When was the last time your doc talked to you about gut health, microbiome, use things like that, strength training, right? When was the last time they asked you if you work out, kind of what your hormones are doing? They don't, and because that's not what they're trained to do. So the system being built on
I'd even go further and ask you, doctor, what what do you know about the drug you're prescribing me? What do you really know about the drug you're
yeah.
prescribing me? Because typically
What did the
that
rep
drug
tell you,
is
right?
what the
Yeah,
rep tell you.
yeah. Yeah, exactly, man. And so, again, the system is built on chronic disease, not health. So if you heal your gut, if you fix your chronic pain through natural things, you're not going to need the system, right? And so that's not good for them. So the functional medicine approach is always root cause, right? We focus on metabolic health, balancing blood sugar, insulin, inflammation before diabetes develops, right? Hormonal health, supporting the thyroid, adrenals, sex hormones naturally instead of just prescribing synthetic hormones, which, bioidentical hormones can be helpful. And I think there's a time and a place for those, but they shouldn't be the first. And you got to use them wisely as well. And then obviously, like, this is a big one, man. Biomechanics and movement, right? If you can correct someone's posture, the way their body moves before the chronic pain sets in, you're going to eliminate the need for things like over the counter NSAIDs, which so many people just eat like candy. And then obviously focusing on gut and immune health function. So the bottom line is the system doesn't want you to be healthy, but we do. We want you to be healthy. We want you to thrive. So conventional medicine isn't interested in those solutions. But if you want band-aids, right? If you just want to cover it up, and this is the weirdest thing, man. We see this a lot, actually. Some patients come in and that's really what they want. They're like, dude, I just want to be out of pain for a little bit. Let's just give me a couple of things. And I'm like, hey, we can do that. If that's ultimately what you want, I'll serve you in that capacity. But we always educate on why long-term correctional things are best. And that's how you can maintain long-term. So that's what functional medicine is.
Love it. This is a great episode, great education for people just to really understand, again, their body and to ask better questions to get better answers. So we're here for you. I love these questions that are coming through, but the truth is real health isn't about coming from a prescription pad. It comes from understanding your body, identifying the root cause of dysfunction, and making lifestyle changes that can actually create long-term vitality.
Yes.
And if that makes us the black sheep of the medical world, so be it. Because the people getting the real results in our clinics, the ones ditching medications, reversing chronic conditions, and actually feeling better, aren't the ones following the mainstream script, right? They're the ones rewriting it. So let's keep decoding health one truth at a time.
Beautiful, man. A great finish there. I love that. Awesome, man. Well, thank you so much for joining us today. We hope this helped. If you have found yourself with these similar questions, if you're curious, please reach out to us. We would love to hear from you. You can go to our website, alessifunctionalhealth.com. You can book an appointment, a consultation with myself or one of my team members, and let's start digging into what's going on. Let's try to find you some answers and then give you some real health solutions. As always, if you like the episode, please share this. Please subscribe. That's how we can expand and we can reach more people. And go, again, alessifunctionalhealth.com, go to resources, sign up for our newsletter. That's how you'll know what's going on in our clinic. Awesome event going on March 8th in Tampa, Florida at Alessi Functional Health. It's going to be a health fair where we're going to do a ton of really cool things and have a lot of really cool vendors and companies out there sharing in the mission. So thank you so much again for joining us. I'm Dr. Alfred Alessi with my co-host, Matt Tack. Stay curious, stay empowered, and remember, your health is in your hands.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.